Good afternoon, Zudin.
Afternoon, Yossi. How are you?
I'm good. I hope you're enjoying the meeting so far.
Amazing so far.
Good. So, Zudin, a couple of questions. At our symposia, you had the excellent talk. And what is important for us is really, can you summarize for us in really few sentences, what are the key messages that you want to really portray to the audience?
So I think the two real messages are, one, that our current nutritional interventions, the energy and the protein that we're giving our patients, doesn't work as far as preserving muscle mass. And we know biologically why this doesn't work. So that's the first thing. So we mustn't fool ourselves into think that we are definitely helping people by giving people nutrition. The second thing is we need if you like, a frame shift, some disruptive thinking to think about how we can generate better energy in our patients and how we can get protein into them at the right time and the right form so they can maintain muscle protein homeostasis.
Right. So this brings me to the next question, where many of the clinicians give now, based on the guidelines, high protein, at least at the beginning, when they are in a catabolic state, the patient are in a catabolic state. So not having those patients moving or exercising, what happens to those proteins and what do you suggest we should do?
So this is a very difficult one, because those patients we're giving high protein concentrations to, we're acting on normal physiology. So if you gave you and I high levels of protein and after doing some exercise, we would build up muscle.
Right.
Okay? These patients are not doing any exercise. We are trying to mobilize them and rehabilitate them, but that's not the same as resistance exercise, which we know they really struggle with. So they can't use that protein for muscle protein synthesis.
Right.
So one of two things is going to happen. It's going to get oxidized and wasted, and it was a waste of time, or it's going to be enter the urea cycle and generate toxins, which are bad for muscle. And that actually is something we're really interested in looking at the moment, trying to understand protein toxicity, which is something, not our group, but other groups like the Carolyn